When I was training in Pittsburgh in the early 90s, I became attached to some of the patients in our hospital who had leukemia. They had been there, you treat leukemia there for a month, and so you develop a relationship with them more than I could with any of the other patients. And those same patients were being sent elsewhere for bone marrow transplants because that particular hospital didn't do them. And that intrigued me, and I decided at the end of my residency in Pittsburgh to pursue hematology oncology. I think importantly, the people who are here and doing it have been here and doing it for a long time. And that's not just the doctors. I've been here since 1991, and the nurses on the floor have been here as long as I have. At least a lot of them have. And it's not just them, it's the pharmacists, it's the infectious disease specialists. People who work at the Cleveland Clinic tend to stay at the Cleveland Clinic. So we have a large body of experience and expertise to draw on that sort of separates us from the pack. Our team is spectacular. It's not, when I say I do a bone marrow transplant, I don't. In fact, I'm not even in the room when these things happen. The nurses on the floor, the nurse practitioners, the physician's assistants, the pharmacists, the doctors of pharmacy, the infectious disease specialists, the blood bank, all have to interact in a symphony in order to make this work. There was a young man who needed a bone marrow transplant. We realized that he needed to do this. He was a newlywed, though, and he wanted some advice before going into transplant. What should he do? And I told him, you should have a baby. Start making babies, because once you have the transplant, you might not be able to do it. And they did. They went on a trip in Florida, conceived a baby at that trip. He survived the transplant, and now that baby's some 15, 16 years old. So I keep joking that I need to pay him for the tuition.